My name is Robert Cooper and I am a member of 7, St Anne's Expert Voices and Experience Network. In this session I'm going to talk about what is meant by an unsafe swallow. By the end of the session you will be able to identify what is meant by an unsafe swallow, sometimes called dysphagia. What happens when food, drink or segregations go down the wrong way. What is meant by aspiration. The difference between aspiration and choking. An unsafe swallow, sometimes called dysphagia, is when food goes down the wrong way. This is caused by a physical difficulty in eating, drinking and swallowing. It can affect any part of the swallowing process. This means that it can affect a person's ability to hold food or drink in their mouth, chew food, move food or drink down into the throat, or move food or drink into the food pipe, sometimes called the esophagus, and down into the stomach. An unsafe swallow doesn't only affect eating and drinking, it also affects the ability to swallow medications, saliva or segregations. We know from video 1 that people with learning disabilities are affected by an unsafe swallow more than other people. Now this can have a serious impact on their health and cause aspiration pneumonia. 50% of people with learning disabilities require support to eat and drink, and 8% of people known to learning disability services have an unsafe swallow. But the real number are probably much higher, as sometimes the signs of difficulties eating and drinking and swallowing are missed. An unsafe swallow can be caused by many health conditions such as cerebral palsy, dementia, stroke or getting older. When food or drink goes down the wrong way, in many cases a person can cough and clear the airway. When food or drink goes down the wrong way and a person cannot cough effectively to clear it, and can pass it to the airway and can then travel to the lungs and cause an infection. This is called aspiration. If the infection is serious, this can cause aspiration pneumonia. The infection can make it difficult for the person to breathe and making them very unwell. In video 3 we will look at signs to look out for that a person has aspirated. 40% of people with a learning disability and an unsafe swallow experience recurrent chest infection, which can cause aspiration pneumonia. Sometimes people confuse aspirating when food goes down the wrong way with choking. Choking is when food gets stuck in the windpipe and prevents the person from breathing. When a person aspirates, there is not immediate risk to life. They will become ill gradually, and it may occur hours or days after food going down the wrong way. If the person chokes, there is immediate risk to life as they are unable to breathe. It is important to take immediate action. Always follow their choking and risk assessment and seek immediate help by phoning 999 if required. Things that can affect the ability to eat and drink safely include poor posture, sitting in the wrong position, distractions when eating and drinking, needing help to eat and drink, eating and drinking too quickly, putting too much food or drink in the mouth at once, or talking when eating and drinking. Eating and drinking difficulties can also result in choking, weight loss, distress for the person, their families and carers, urine infections and dehydration. Often an unsafe swallow can be managed, and with support and changes, people can be helped to eat, drink and swallow safely. In video 5 we will look at working with other professionals to identify the difficulties, support the person and the people around them to manage those difficulties, minimise the risks, and most importantly, ensure that the person has a good quality of life. We shall now be able to identify what is meant by an unsafe swallow, sometimes called dysphagia, what happens when food, drink or segregations go down the wrong way, what is meant by aspiration, the difference between aspiration and choking.